Hi, Elaine Miller. Nice to have you on our Zoom session today. We're just doing a brief interview just to talk about this exciting show that you're bringing to the Audacious Women Festival. And it sounds really interesting and something that all women, no matter what their age, will benefit from. So, first of all, myself, and I'm sure all the other people who are looking at this course would like to know a little bit about you and why you developed this show. Where did it come from?
Well, thanks for having me on. I'm excited about this. So my name is Elaine Miller and I'm a physiotherapist in Edinburgh and I specialise in pelvic health. So people come to clinic for pelvic health if they're having problems controlling their pee, their poo, their pumps, if they've got a sexual dysfunction or a prolapse. And it's a really good area to work in because they get better if we can get them into clinic. Physio's got a really good cure rate for anything to do with stress incontinence, and it can help manage vaginal prolapse really well in the majority of women if we get them to come. But only about 25% of women ever seek help for their urinary incontinence. And that frustrates me, apart from anything else. From a job security point of view, I need to get punters in the door. But it's the shame and stigma that surrounds these problems that just stop women from being able to take care of themselves. So I had a patient tell me a story about her wetting herself on the doorstep one time, and it's a horrible thing to happen to somebody, but she was Glaswegian, so it was hilarious in her telling of this horrible situation that she'd been in. And I asked her if I could use the story in stand-up, because at the time I had a hobby of doing stand-up comedy. So I did a 5-minute talk about our section about wetting yourself on the doorstep, and 4 women came up to me in the comedy store in the comedy club afterwards and said, "Oh, me too." Now, they didn't know it was my job, they hadn't spoken to their GP, but they would come and speak to somebody in a pub about this problem in a sort of solidarity sister way. So I thought maybe you could use humour to get round the embarrassment, and I wrote a comedy show called Gusset Grippers, which is all the information that you would give somebody in clinic, just, on stage with a vulva puppet and a and a vulva suit singing a song. And it did well at the Fringe, and I mean, that's Scottish modesty, isn't it? It really did well, and it got 5 stars, and I was invited to Australia this time last year to the comedy festivals there, and it won the comedy award. Go me.
Really?
So so I'm really pleased with how it's done. And the idea behind it is to try and encourage help seeking and bring down the taboos, but also I think that humour is a useful health promotion tool. So I'm doing supposed to be doing some research to see if we can show that, because then we could do it properly. We could have a proper public health campaign just to tell women that they don't need to put up with this, and that there's lots they can do to help themselves. And if it doesn't work, come to clinic. There's loads that we can try.
Yeah, that sounds really powerful. I think that humour quite often does manage to get to areas that are uncomfortable for people to talk about. No, that's amazing. So tell us, what can we expect in the session that you're going to do for the Audacious Women Festival? And
Well,
wearing this suit?
I could do. I could do with just this bit of it. It's my face is the clitoris in the suit, so that would work. Pay attention to the clitoris. Actually, look, I've got a wee model clitoris that my friend made me. How good is that?
It looks like a flower, doesn't it? It looks like a snowdrop or something.
Yeah, it's life size as well. It's amazing.
No, is it life size?
Yeah.
I don't know whether it's zooming in on my camera or what.
There's the wee bobbly bit that people know where it is, and then there's all this gubbins underneath it, but nobody tells us. So I'm going to talk about that in the session that I'm doing at Audacious Women. And I've got my knickers in a twist about the barriers to help seeking that exist that prevent women from being able to find help for these problems. And they're enormous. There's so many of them. And a lot of it comes just down to patriarchal ideals. It's really depressing to have to come out with these sort of almost trite expressions, but it is true. Women are embarrassed by their genitals because they've been taught to be embarrassed by them. They've been taught that they're dirty and that they're shameful and you shouldn't touch them, and that female sexual pleasure isn't really very nice, that good girls don't do that. And these myths are so pervasive that they actually reduce women's quality of life in a way that's completely unnecessary and makes me very cross. I'm finding that the older and hairier I get, the more cross I am becoming about all of this. So I had started looking at medical misogyny, which is a well understood concept. It's well established, it's well researched, and yet it persists. And the recent mesh inquiry that was done by Baroness Cumberledge, looking at why so many women were injured by this implant that was supposed to be, curative and an amazing innovation. And for many women, it has been. For many women that have got mesh implants, it's totally transformed their life. But there is a percentage of them that it's caused all sorts of awful complications. And the findings of her inquiry were basically we should listen to women, which is frustrating because that was also the findings of many other inquiries into women's health where things went badly wrong. Yeah. Because we just don't get listened to. So I am going to have a bit of a rant about that, but with a view to saying these are things that have happened historically. This is what you need to do in order to be able to advocate for yourself. And the hope would then be that if a woman did have a problem with her genitals or reproductive organs, she would then be able to have the words to go and speak to her GP about it. Half the time women don't even realise that their symptoms are a problem. They just put up with them and think that it's normal because their mother had the same thing, and it's not correct.
Yeah, no, it's so true. I think if women can feel more empowered after this session to take responsibility for what they should be getting from their doctors, that would be really quite something to come away from the workshop.
Yeah, we don't teach women.
Scandal is just really shocking, and I'm sure there probably are women who are going to be attending who've probably had a lot of the experiences that you're talking about. So to be able to be with other women who've had these problems, and be able to talk about it, because as you say, it's not easy to, because the structures that we have lived within, and being embarrassed, not being able to talk about things, it's difficult.
Yeah, social media has been really important for those women because they've been able to find each other. A lot of them reported situations where they were telling their consultant about symptoms that they were experiencing, and those were being dismissed because the consultant didn't register that was actually related to the mesh. And the women were quite clear that it was relevant, but because it wasn't in the sort of quality outcomes that the surgeons were looking for, which was a reduction in your leaking or a reduction in the symptoms from prolapse, then they weren't linking this sort of reports of chronic pain and some very odd symptoms. Some of the women have had really bizarre consequences to the mesh implants. So they found each other on social media and then were able to do what you're saying. They just built up a support network for themselves. And that's how they managed to take on the government, which is a remarkable achievement, really, that they just would not be told no. So yeah, the power of having women being able to share experiences and get empathy from each other as well, because these problems are so isolating. That is really, really important. They've achieved an awful lot. It's really impressive.
Yeah, no, it's devastated lives, but a ridiculous thing as well, as you said, that it required an inquiry to state the obvious, that you should actually listen to women.
Yeah.
Like quite something, isn't it? So during the workshop or the talk, are you going to be sharing any resources? I mean, do you have a Gwyneth Paltrow egg there?
I do actually. I've not got it here. I've got an egg that somebody sent me that comes on a necklace that you can wear around your neck so that you don't lose it. And it's a great big bit of rose quartz. It's very beautiful. I don't think I'd stick it up my chuff. I have it's too pretty to go up there. Yeah, I'm going to talk about the sort of snake oil salesman that exists. There's a whole industry of people trying to sell rubbish to women that are distressed and desperate for help. It's a huge industry, and I would put Gwyneth, I'm sure she's very, very well meaning, but I would put their marketing in with that label. She was a big advocate for vaginal steaming for a while, a couple of years ago, and there was an unfortunate woman who took the Goop marketing on board, sat herself on top of a kettle and got written up in the medical literature as a case study because she gave herself 3rd-degree burns up her vagina. And this was not, a young woman who was, easily led. This was a mature woman who just believed what she was told and had to have skin grafts. Like, it's so irresponsible, so irresponsible. So yeah, it would be really good to see people that have got products that have got evidence behind them, because there are some amazing things out there that actually are really helpful that you can just buy online. But they often are quite small companies and they can't get over the traction that big manufacturers or big companies have. And I would include the pad manufacturers in that as well, that some of their advertising historically has been deeply problematic with the way that they represent incontinence as a feature in a woman's life. As I don't want to name brands, but some of the terminology that they use around it, it's normalizing a symptom that's deeply distressing to women and saying, it's all right, it doesn't really matter, we all get it, we're all girls together. And that's just factually incorrect. This stuff causes depression and is linked with diseases of inactivity. And pads are brilliant because they solve the immediate problem and they let women get out the house without worrying about embarrassing themselves in public. But they're not a cure, they're not a solution, and those things exist. So I would really like to see a bit of tightening up about advertising of any products that's got anything to do with women's genitals, so that it's based in fact, and then sort out the education of women as well, so that we know what we can reasonably expect. 50% of women don't know what's a vagina and what's a vulva in the UK in 2020. It was a survey that was done last year. That's just shocking, absolutely shocking to me. So yes, we will aim so that you can know what's decent to buy and not basically anything that Goop sells. I wouldn't be a fan of that. Although she did have her fanny candle, didn't she? Bless her.
So you showed us one of the things that you've got, one of your little...
oh yeah, the clitoris, yeah.
You've got a whole table covered in things in front of you there, haven't you?
Well, one of the things that I get annoyed about is the way that we don't teach women about sexual pleasure, that sex ed doesn't include that. We teach boys about erections and wet dreams, and we teach girls about periods, that we're leaving our young people to be educated by porn. And I don't think that's great. And there's not, some of the products that are available in the adult market are really closely aligned with what we would use in healthcare. And some people would prefer that because they don't want to be, medicalized, and other people are absolutely horrified that it would be something from an adult market. But I don't see that there's an issue myself, just, personal preference, who cares? But you have to be 18 to buy an adult product in the UK, but the age of consent is 16. So what are we telling these young women? That, you can have sex, but you shouldn't be enjoying yourself too much for another 2 years. It's ludicrous. So I've got like some comparison stuff. So this is a set of dilators that the NHS would supply. This is the big one. Hang on, I should have opened it up a bit. So it comes in a range of sizes. It goes from the small one, up to the more functional sized one. And they're used for women that have had radiation treatment after they've had cervical cancer or vulval cancer. And they're often prescribed for women that have got vaginismus as well, pain and penetration. So that's a medical piece of kit. That's not, but from a functional point of view, they do the same thing. Now, for women that have got pain and penetration, if they're wanting to have penetrative sex and they're given this thing, it's quite hard and it's quite unfriendly looking. And usually when women are having sex, then they're kind of into the idea, hopefully, that they're sort of warmed up a bit. Trying to stick that into a slightly shocked vagina, you need to, warm yourself up a bit. So why would you not use something that's a bit more friendly? And there's an adult shop in London it's by women for women, and they designed a set of dilators that do the same thing as the NHS one, but look what they did. They put a vibrator in the dilator. How clever is that? That's advertising as well. It's Shush Women's Store. I think this is genius, and it's soft.
So
Whereas this one's really hard. And it's because it's designed for something different.
so
It's
yes,
for
it's a man who designed that one then.
if somebody's had radiation to their vulva, then the tissue changes and it can become a lot. It needs a bit more. It can become more resistant, so it does need to be harder. But the majority of women would manage with something a bit more flexible. I think that's just genius because it's supposed to be fun. You shouldn't be having to grit your teeth and think of. I was going to say think of England, but I don't suppose that's very appropriate anymore. Think of Nicola Sturgeon. I'm not sure about that either.
Be a positive feedback exercise, doesn't there?
Yeah.
Yeah, no, well, it sounds like it's going to be a really, really informative and funny session. I'm
Well, I hope so.
enjoying it. And I think, that the difficulty that lots of people have about talking about what is a part of our lives. Everybody suffers from this at some point.
Yeah.
Has difficulties, and we not being able to talk about them, and not being able to go to the doctors early enough about problems and all of those things. This workshop will really help with that. And I guess one question left for me to ask you is, have you yourself had any embarrassing situations?
Oh yes, I had 3 children in 4 years who were all rude enough to be born with heads, which was kind of annoying, really. It's just in it inconvenient. Yeah, so that's part of the reason why I got so exercised about all of this, because I do know what it's like to not have complete confidence that your body will behave itself when you're out and about. And when the when the kids were little, we had sports day at the school, like you do, and because they were close together in age, when my daughter started school, I had, a small baby, and the race that the mums were to participate in was the sack race, which is, in retrospect, I did not belong in that sack race, like handing the baby over, getting into my Hessian sack and hopping down the field with my daughter. So inevitably I lost complete control of my bladder, was absolutely saturated, but I was in a sack. So I had, if it's going to happen, being inside an old tatty sack is probably the best place to be. But the thing that struck me about it was that obviously if you wet yourself, instantly, and you just stop moving. And the other mums, because of the look in my face and the way I behaved, they knew exactly what had happened to me, and they all sort of swarmed around me to help sort me out. Yeah, it really was amazing. It's like women understand what other women need in the moment, but that was a low. That really wasn't. It really wasn't very elegant at all. Mm.
We've all got our stories, all of us,
Yeah,
one of us, and that's why we need to stop being embarrassed about it. The
I
more we
think
talk
so.
about it, then the less embarrassing it'll be. We'll be able to laugh just like you were able to laugh, Elaine, there sharing your own story. And I'm going to finish off there because we want to leave you with lots more for your event on the weekend. So can you just remind us when your event is?
It's on Saturday, this coming, which I think is the 21st, and it's at 12 till 1.
Okay, 12.
Tickets are free, donations are welcome.
Yes. Oh, well, we definitely want to have some donations to help with future events going forward, and really look forward to that event with you on Saturday. So thank you very much. And